Thank you so much for inviting me to speak on behalf of breastcancer.org. It's an honor to be part of this important event with you, leaders in the Hispanic community and community allies who are working towards a better, more equitable, and inclusive future. I founded breastcancer.org as a nonprofit in year 2000 because I believe that people with breast cancer need more information and support than a doctor's visit can provide. Our mission is to help people make sense of the complex medical information about breast health and breast cancer so that they can make the best decisions to protect their precious lives. We want to ensure that people, regardless of their backgrounds or where they live or where they came from, have access to expert guidance on the enormous amount of breast cancer information, treatment, and research options that are available. We offer resources and an online community in both English and in Spanish. And if you or someone you know is in need of support, we welcome you to be part of our community. The reality is breast cancer impacts all of us. And for Hispanic women, we know that compared to the national statistics, Hispanic women have a lower incidence of breast cancer. That's 1 in 10 women versus 1 in 8 for other women. We also know, however, that among Hispanic women in the United States, breast cancer is the most common type of cancer and the leading cause of cancer deaths. Hispanic women are less likely to get an annual mammogram over the age of 40. They're less likely to seek medical help if something's wrong. And there could be a lot of reasons for this, but we know that we need to improve awareness and education to close that gap. For women who have recently immigrated, a language barrier, unfamiliarity with a healthcare system, or less access to doctors are all barriers to timely treatment. Hispanic women are also more likely to have breast cancer at younger ages, at later stages of disease, and also to have more aggressive types of breast cancer. And being diagnosed after cancer that has already progressed or advanced or spread could be linked to a delaying seeing a doctor when they know maybe something is terribly wrong. We need to remember that the Hispanic community, of course, is extremely diverse. There's no one size fits all. There's no monolith. And breast cancer inherently affects groups differently. For example, the country of origin alone is a unique characteristic that impacts cancer incidence as well as mortality. The bottom line is that as the largest minority group in this country and growing, it's important that Hispanic people remain vigilant about breast health and get the best access to the best forms of treatment. Now let's talk about risk reducing steps that all women, and especially Hispanic women, can take in their everyday life to promote their breast health and their well-being and to protect themselves against breast cancer. Probably the most important step for all people is weight reduction and just trying to get to and stick to a healthy weight. And I'm not talking about skinny, but the reality is that a third of breast cancers in this country are due to being overweight. And the best strategy against it is a healthy diet. Sounds boring, but that's just the truth, that 80% of weight management is related to what we eat, and about 20% is exercise, also really important. Alcohol restriction is important because the more you drink, the higher the risk. We recommend that women know that 3 or fewer is best and less is more in this situation. Screening, getting your annual mammogram, going to see your doctor for a clinical exam, all really important and really help people find breast cancer early when it's most treatable with the least aggressive treatments and the lower likelihood that you would need mastectomy. Important also is breastfeeding. Breastfeeding helps reduce the incidence of breast cancer. It's better for the mom, better for the baby, and it actually helps reduce the incidence of the more aggressive types of breast cancer. And finally, just a word about genetic testing. It really helps us identify people who are at elevated risk because of maybe something they inherited, but it also guides treatment. And it's not something to be fearful of. It's like a light that guides your path that helps us take better care of you. So I just want to thank you all for the good work that you're doing. You're saving lives and protecting people. and their families. We're so grateful to you. And thank you so much for having me and letting me be part of your movement. And I'd like to wish all of you a safe, happy, and healthy, and promising, and more hopeful new year.